Welcome, everyone, to our second COVID-19 Q&A. I'm Max Topper with Physicians Health Center, and we are the OCMED centers in Miami-Dade, South Broward, and Monroe counties. Just like Emmy Award night, we're virtual today, and with me on Zoom, joining me is Elisa Garvin, members of my team, Zach Rosenthal, and Dr. Susan Nelson, our medical director. Also joining us from HR Law is Nancy Curry and attorney Andrew Borah. As your OCMED providers, we have been responding to your pressing questions on COVID and staying in close touch with the CDC as well as the health department. For the last 4 decades, our main focus has been on treating work-related injuries. Now we're also helping our employers and their employees to safely return to work during this pandemic. Now let's go. Zach will be sharing his screen for the Q&A. Questions have been submitted in advance, and others you may add to the Q&A as well as the chat box on the bottom of your screen. Please stay with us till the end, because then you'll be eligible for our prize wheel, which has become rather popular, to win a great prize. I'm going to ask Elisa Garvin from my team to please now introduce Dr. Nelson, and then Nancy will introduce Andrew Borah. Thank you. Elisa?
Good afternoon, everyone, and thank you for being here today. I have the pleasure today of introducing Dr. Susan Nelson. Dr. Nelson joined Physicians Health Centers in 2004 as our lead physician. Her dedication to occupational health reflects in her medical care that she provides to each patient and the respect that she has earned from her employers. Her training includes family practice, FAA medical examiner, medical review officer, travel medicine, designated civil surgeon, and earlier this year, Dr. Nelson has been named Physicians Health Center's medical director. She avails herself to employers to answer their questions and discuss their employees' medical plans. Dr. Nelson has been at the forefront of COVID-19, providing direction to our staff on implementing precautions to maintain a healthy and safe environment at each of our locations, as well as providing guidance to employers. And now, Nancy will introduce Mr. Andrew Borah.
Thank you, Elisa. Thank you very much, Max. Thank you, Dr. Nelson. Thank you, Zach. We are delighted to join you guys today for this forum. It's a great one. HR Law has been representing employers and carriers for almost 30 years in workers' compensation, and we are proud to have the deepest bench of board certified specialists in the state. 13 of our 32 attorneys are Florida Bar board certified. So we're very happy about that. And of this crew, you need to know that Andy Borah, or Andrew Borah, is one of the most seasoned and successful defense attorneys in the state. He has been board certified in workers' comp since 2009, and in that time he has had actually 68 trials, and he has got a really impressive success rate of 84% in his trials. So I think that tells you that he has a lot of answers. He's seen a lot of things, and I think he can explain a lot and answer a lot of questions. So I will be done and just pass you on to Andy and let him start things off.
Okay, so right before we begin, I just want to again reiterate that we do have questions that we've already received, but if you do have anything that you want to pose as we're discussing, there is a Q&A section. So please try to put it in the Q&A. There is also a chat box if you have any comments you want to make. We will do our best to get to all the questions during the session. It may happen that we are not able to get to every question, but what we did last time is we compiled those questions, had everyone respond, and then we sent it out as an email after the event. So again, we will do our best to get to them, but if we don't get to all questions, we will provide you an answer in the near future. So let's just begin. So if everyone who's not speaking, if they could hide their video and audio. Okay. So first question, this is for Dr. Nelson. Who should be getting tested for COVID-19? I know there was a new update of clarification by the CDC. When should people be getting tested?
Okay, hello everyone. Today is really it couldn't have been planned better because there've been some confusion, some updates with the CDC this week. So this is perfect, extremely perfect timing. Who should be getting tested? Well, basically at this point, everyone should be getting tested, but there was something new that had come out about asymptomatic versus symptomatic exposure. Before the CDC, they had mentioned that people who were who weren't symptomatic, who were positive for COVID-19 but were not symptomatic, were not as likely to give it to somebody else, which is not the case. So if you, for example, in a work setting, if somebody has been tested and was tested positive for COVID-19, you would need to do what's called contact tracing. Now everybody, and people still don't know it or still don't go by it, but obviously everyone needs to be masked. Everyone needs to be socially distanced 6 feet. If not, the rule for someone getting tested, if you were exposed to somebody, if you could find out by the contact tracing, the incubation period is between 2 to 14 days. So if you were exposed to somebody, and if you were exposure means within 6 feet, which you shouldn't be, but sometimes there's no choice. If you were within 6 feet or unmasked and for greater than 15 minutes, that would be considered a close contact. But you would have to go 2 days before that, before that person was tested positive. So you would need to go back and see who would classify under that. So if that was the case, some companies are even, going the extra mile. They're saying, we really weren't, there really wasn't a close contact, but somebody did test positive and we want them to be tested anyway. And that's fine. But really it would be if you were less than 6 feet, more than 15 minutes and unmasked, then definitely you should be tested, and that would be for 2 days, even 2 days before you found out that person was positive, symptomatic or not symptomatic. Like I said before, just to reiterate, CDC was saying that if the person isn't symptomatic, that there really wasn't so much of a chance of being contagious, but that's not the case, because you can be asymptomatic and still pass it on to somebody else. So that was one of the new things that came out that they were trying to get right. Also, we've been doing some telehealth for companies, and they'll have their wife or husband, significant other tested positive, and then the next day they'll go out and get tested and, oh, it's negative, we're fine. No, there's an incubation period. So they could test negative 2 days after the next day after, but they still need to be quarantined for 14 days and then be tested. If they're tested in 14 days and it's negative, then they're fine. If not, because they could still not be shown positive yet.
Because I know the CDC had said that if you did test positive, but you didn't have symptoms for a certain amount of time and were without a fever, that you could just return to work without a COVID-19 test. Is that still the case, or are they saying now that you should get a test?
For what was the first part? I'm sorry.
If someone were to test positive and they had symptoms, they were stating that on the CDC that if they were without symptoms for a duration and didn't have a fever, that they could return to work and not need to get a COVID-19 test.
Oh, okay. That's about returning to work. You're talking about returning to work.
Yeah. So along those lines, is that still the recommendation?
Yes. Before there was before it was definitely test-based as far as returning to work. They would have to be in 14 days. They would have to be retested, and they need to be have 2 negative COVID-19 tests greater than 24 hours apart. Now, they also have the symptom-based. You have to be 10 days from the start of symptoms, and be asymptomatic and without fever for at least 24 hours. So some companies still want the test base, still want to see those 2 negative tests. Some municipalities still want the 2 negative tests, or instead of the 10 days, they want the 21 days. It all depends, but the CDC is saying 10 days. And of course they are, I mean, that's who you go to for the information. Not your neighbor, not your hairdresser, not your, that's where you need to go. So definitely, but of course we're dealing with a lot of different companies, municipalities, and through telehealth mainly as far as these cases go. And it depends on the company, and we need to go by what they're recommending. If they want the 2 negatives, or if they want the 10 days, or if they want the 21, they would let us know what they would want. Because we've had people who remain positive. It could be weeks or months that they're positive, but they're fine. And after 10 days since the initial symptoms, they're no longer contagious.
Okay. And I think we just addressed this question to discuss who, what considers contact.
Okay, yeah.
So we did talk about that.
Yeah, contact would be less than 6 feet, unmasked, more than 15 minutes, which should not be the case. But unfortunately, it happens. It happens, but that's what contact would be. But some companies still, even with that, I wouldn't necessarily consider it a contact. They still want them to be tested, and that's fine. Always better to err on the side of caution.
Yes. Okay, so Andy, we'll keep this informal. I'm going with Andy.
Thank you.
How does Florida workers' comp statute protect employees who contract COVID-19 at work?
Well, someone who's entitled to workers' compensation benefits due to contracting COVID-19 at work is entitled to the same exact benefits that any other worker who sustains any other type of injury would be entitled to. And in workers' compensation, it's actually pretty easy. There are only 2 types of benefits that an injured worker is entitled to. The first one is lost wage benefits. We call them indemnity benefits. And there's 2 types of indemnity benefits. We use a lot of acronyms in workers' compensation. And the first acronym is TTD, which stands for temporary total disability. And the second acronym is TPD, which stands for temporary partial disability. And what these acronyms mean are different types of lost wages that they are entitled to be paid for time missed from work due to sustaining the work-related condition. So if someone has been accepted as having COVID-19 due to an exposure at work, and they have been told to stay out of work, they would be entitled to temporary total disability, which is a form of lost wage or indemnity benefits. Now, there could be a situation where they said you can work, but you have to work with some type of limitation or restriction, then they'd be entitled to temporary partial disability, which would be a different form of lost wage benefit or indemnity benefit. Now, the other half of the workers' compensation benefit is medical care. So workers' compensation pays for the injured workers' medical care. And that would be the other thing, how the workers' compensation statute would protect an employee who has contracted COVID-19 at work, whatever medical care they need for their recovery. And as Dr. Nelson can explain, there's some positive diagnosis where the medical care is to a minimum. It could just be make sure you stay at home and quarantine yourself, and that's it. Then they're to the opposite extreme. There are people who are actually admitted into the hospital that need significant medical workup. And then there's everything in the gamut in between. Under a workers' compensation situation, the entire cost of the medical care would be covered by the workers' compensation insurance company or by the employer through workers' compensation. The benefit of having workers' compensation cover it rather than their personal health insurance, if the worker has personal health insurance, in a personal health insurance situation, they are responsible for deductibles and co-payments. And workers' compensation there is no such thing as a deductible, and the only copayment would be after they reach maximum medical improvement, and it's just $10 every doctor's visit. But everything before maximum medical improvement is paid for 100% by the employer and their workers' compensation insurance company. So that's a huge benefit that individuals who are just getting covered by their personal health insurance don't have. So those are two ways that the workers' compensation statute protects employees who have been able to determine that they have contracted COVID-19 through work.
So can COVID-19 be considered a compensable work accident injury?
The answer is definitely yes, it can be. So this is a maybe. So if the injured worker is able to prove, or the worker is able to prove that they contracted COVID-19 through a work-related exposure, then yes, they would be entitled to benefits through the workers' compensation system. The hard part for the injured worker, which we're going to get to in a little bit, is that proof. And we're going to get into this in a little bit on some of these other questions. I think in a standard exposure situation, the deck is really stacked against the injured worker in proving they got the COVID-19 due to an exposure at work. The more often than not, if someone is going to be successful in establishing that their COVID-19 diagnosis is work-related, is people that work in professions that tend to be at a higher risk. And in those professions, a lot of their employers, their municipalities, the state of Florida, have internal policies in place that if there is a positive diagnosis, they're really going to just accept it as being work-related without forcing the employee to prove it. But that's only in a very select few occupations and for companies and municipalities. Most of the workforce is going to have to prove it the old-fashioned way, and the deck is really stacked against them, and it's going to be very hard for them to do.
Could I add to that?
Yes.
Okay. Yeah, because we're doing a lot telehealth wise with different municipalities, and there are some that, especially the first responders, for example, police and fire, if they develop COVID-19, it's work related, and that's it, and they accept it as such. Corrections as well, because the likelihood as far as workers' comp, have to be at least 51% related to the job. I mean, it's going to be if you're working in a hospital and an emergency room dealing with COVID-19 patients, but in other jobs, you can say, person next to me got it, and now I have it. Like you said, it's very. How do you know? Just like with any type of injury, with a back injury, did it happen at work? Did it happen at home? Those are very hard to prove, but some of them are just automatically, because we would have to assume with the first responders, corrections, those type of positions, that they contracted at work.
Yeah, so we just received a great question from the audience, from Allie. I wanted to pose this to you. In some states, the burden of proof is on the employee to prove the exposure of COVID-19 from work. In some states like California, the burden lies on the employer. How does this apply to Florida workers' comp?
Well, Allie, that's a great question. And that question is actually question 4 in our slides.
Oh.
And so I can do a sneak preview of the answer to that question. But in Florida, under an exposure injury theory, the employee, the worker, has the burden of proof. And it's a very high burden of proof, which we talked about earlier. And we'll go into that, what they need to prove. But for exposure injuries, it is the employee that has the burden of proof. And even for an occupational disease standpoint, it's the employee's burden of proof as well. So either way they go about it, it's the employee that must prove it. For one of them, it's going to be practically impossible for them to prove. For the other one, it's a little easier, but it's still going to be pretty difficult.
Okay, so let's get right into it. So under what theories of workers' comp can COVID-19 be considered a compensable work accident?
Well, the first one is the exposure theory. And under both theories, it is the employee's burden of proof. But the exposure theory is very difficult for an employee to prove. Now, exposure can be exposure to anything. It can be exposure to someone who has COVID-19 and they've somehow contracted COVID-19 and they believe it's due to that exposure, or it could be exposure to a substance, mold, anything of that nature. All of these exposure injuries under workers' comp, since the statute got amended in 2003, it is very, very difficult for an employee to prove that they sustained this work-related exposure. And there's three things that they need to prove. First is, what is the exact substance that they were exposed to? Now, under a COVID-19 situation, it's going to be easy for them to prove that if they can show they were in close proximity to someone who is diagnosed with a COVID-19. Okay, but the problem that they have is, are they, quote unquote, patient zero, or are they patient one? Patient zero means that they were the first person to have the COVID-19 and they gave it to someone else. Because say that you have two people in a workforce that have COVID, you don't know who gave it to who. And in a situation where the employee has to prove that they got it for work, it's going to be practically impossible, because even if they know someone who has been tested positive, it could be that that person got it outside of work and gave it to the other person. It's from a medical standpoint. Dr. Nelson, can you prove this situation? Who gave it to who?
No, there's no way to prove it. And if two people in the workforce have in the same job, one person could have got it on their own and the other person could have got it on their own. Doesn't mean that one gave it to someone else. So that's, like you said, that's next to impossible to prove. Yeah,
it's very hard to do.
There's no way of proving that, no.
Because even if they say, okay, was a close proximity, again, yes, you're the very close proximity, but it could be you who was giving it to the other employee, and everyone has a life outside of work. We all go to the gas station. We all go home. We all live with other people who do the same exact things. And it would be impossible to trace everyone's outside of work lives to make a definitive answer as to how you contracted the COVID-19. And the burden of proof that they need to prove is called clear and convincing evidence. And that's a pretty high standard. Some people compare it to numbers, to percentages, and they say you have to prove with a 90% certainty that you got it through work. And with all these extraneous factors about what people do in their outside of work lives, and it really is impossible to prove with that high burden of proof of clear and convincing evidence. Now, assuming they're able to meet that they went ahead and they were exposed to something at work, they also have to prove the specific level of exposure. I guess that's something that they can maybe do by testing the other person, but it's hard as well. And the last thing is they need someone like Dr. Nelson, a medical professional, to say that I believe, I'm reasonably certain that this work-related exposure is what caused this individual to contract the COVID-19. Now, I believe, Dr. Nelson, have you even given an opinion like that in the past couple months, where you got a set of facts where you were reasonably certain that this, without a presumption, because I know a lot of municipalities have a presumption, but you were reasonably certain, independent of any presumption, that whatever work-related exposure was the cause of the positive COVID-19 diagnosis?
No, because the ones that we're seeing are the ones that are automatically assumed that they're work-related, with the first responders, with the municipalities, with those. So otherwise, no. We haven't. We've done some fitness for duty, as if somebody was exposed, or if they're exposed at the workplace, or they were in contact with somebody, and we do the telehealth as far as those goes. But those are fitness for duty. Those aren't workers comp. Those are seen separately. But as far as that, no. Only the ones that are assumed that they're 100% from work.
And Dr. Nelson's not alone. I haven't seen any doctor indicate that they've given an opinion where some type of work exposure was the cause of their COVID-19 diagnosis, because it's just practically impossible to do, especially from a clear and convincing standpoint. So from an exposure theory, it is really pretty much mission impossible. I haven't seen it. I don't think I'm going to be able to see it for an injured worker to prove that their COVID-19 diagnosis was due to something that occurred at work. The next theory, and I'm going to go into a little more details, is the Occupational Disease Theory. And that's when you work in a high-risk occupation. And I think there's a different slide that goes into what those high-risk occupations are, and we'll get to that in a little bit. But because they're in a high-risk occupation, it's a little easier for them to prove. But they still have to prove it with clear and convincing evidence. And most of the time where I've seen it, where COVID diagnoses have been picked up, it's typically in an internal policy by the employing agency that we want to not put our employees through these hoops. And it's kind of like a fringe benefit that we're going to go ahead and just presume it's work-related and give them benefits under workers' comp. But that's only in situations where the employer is making the decision. I have not seen any situation where an insurance company or a carrier has made that decision, because they typically are insuring a lot more people than an employer would be. But that's the only situations where I've seen where these COVID-19 diagnoses have been picked up as compensable under workers' comp.
Yeah. So there was just another question posed in the chat that kind of goes along with this. They were asking, if my associate is treating for work-related injury and contracts COVID-19 during the treatment, am I responsible for treating the COVID-19? So example, they go for surgery and then they contract COVID-19.
Well, the answer would be yes, if you were able to prove that they contracted the COVID-19 because of being under surgery. If somehow the doctor was diagnosed with COVID-19 and the claimant got COVID-19, and someone like Dr. Nelson was able to say that, okay, this person contracted COVID-19 due to the close proximity to the doctor, then in that hypothetical, the answer would be yes. However, I don't think that hypothetical is realistic, because as Dr. Nelson would say, is that even if the doctor was later tested positive for COVID-19, the patient could have given the doctor COVID-19, and the patient could have gotten COVID-19 outside of the surgery. So again, it's very difficult to pinpoint where the exposure actually occurred that caused a positive diagnosis. So the same problem that an ordinary worker would have in regards to proving compensability of their COVID-19, an already existing workers' compensation claimant would have the same exact hurdles that someone who did not have sustained an injury. So while it's possible, it's highly unlikely and difficult to prove. In light of that, I think it's extremely unlikely that they would be able to obtain benefits because of that.
The same thing would be if they're undergoing physical therapy.
Correct.
I mean, I guess if you can, you can trace it back if one of the therapists or somebody there. But again, like you said, did the patient give it to the therapist? I mean, those kind of things are very hard to prove.
So next question, what must an employee prove under exposure theory to have a compensable claim?
Well, this is a kind of repetition from what I indicated earlier. There are three things. You need to prove what they were exposed to, the level of exposure, and they need to prove causation via medical testimony, via major contributing cause, all with the heightened burden of proof of clear and convincing evidence. It really is a mission impossible situation for most exposure claims, exposure to mold, asbestos, only these typical things. And COVID-19 is going to fall right in line with that because it's really difficult to prove. And I think that one of the questions on the chat was, I thought there was no way to quote unquote prove where you contracted COVID. And so far, that's been the case in my dealings in the workers' compensation industry. I haven't had anyone definitively prove that they were exposed and to the COVID in the workplace, and that's how they got it. I'm sure there's a hypothetical out there that it could happen. I just haven't seen it yet. And so it's going to be very hard to prove under an exposure theory.
Okay, so what must an employee prove under occupational disease theory to have a compensable claim?
Well, the main thing they have to prove is that they're in a certain occupation that has a greater likelihood of risk to be exposed to COVID-19 as compared to the general population. Now, I think Dr. Nelson went over this a little bit already, but Doctor, are there certain occupations that you believe that have a greater risk than the general public in regards to being exposed to COVID-19?
Oh, definitely. If you're a first responder, if you're police or fire, you're the first one called to the scene. If when rescue is called, and we have to assume now that that you're positive for COVID-19 until proven otherwise. So they're right on the front lines, and you can't. I mean, they're masked, but you can't always be 6 feet apart. They may not be masked, so they're definitely corrections, which is they're exposed to a lot of people, large population again, who might not all mask. And obviously people who work in the medical field, who are in emergency rooms, who deal with COVID-19 patients. They protect themselves, they put on all their personal protective equipment, but they're still exposed. So those definitely would be the occupations would have the highest risk, and it would have to be assumed that they got it that way.
And let me interrupt, it's Max, just to say probably a lot of our nursing homes, no, Dr. Nelson, because they've gone into nursing homes where there's already a lot of COVID. Would they be under that category?
The workers of the nursing home?
Yes.
That I'm not sure of. I think that would be under the case of the how did you put it, Mr. Borah, the convincing evidence, because it's really the other way of nursing homes. Some of the employees there
Are bringing it into the nursing home.
Are bringing it in because they're saying
yes.
you can't have any visitors, but the people who work there have a life, and it's mainly them bringing it in, not getting it from there. So that would be
correct.
kind of the opposite. Yeah, unfortunately.
Thank you.
Yeah.
You're absolutely correct. So I represent a lot of insurance companies that provide coverage to, home health and nursing home centers. And that's the argument that is raised, is that it's a closed containment. It's kind of like a bubble. We talk about sports now. A lot of these sports are in this bubble. Well, these nursing homes are a bubble. They're not allowing visitors, or they're strictly monitoring visitors who can come into this bubble. So therefore, if their bubble gets contaminated, it's because of an outside source. And so therefore, that would make it not work related. But then there's a little bit of a chicken or egg situation. If you have more than one people who test positive, or employees who test positive at the nursing home, they're not going to be able to determine whether they got it from another coworker who got it outside the bubble, or if they themselves were the violator and they brought it into the bubble and contaminated themselves. It's going to be very difficult to prove. So I do not believe myself that in a nursing home arena, they would be considered an occupation that would be high at risk. But however, I do have clients that have insured nursing homes, and they are accepting the claims. So it's all on a case-by-case basis, and sometimes there's a reason for why they would want to accept it rather than deny it. And sometimes, it's really a personal choice for the insurer or the employer.
So would that same situation apply to, let's say, restaurant workers or people working in retail that deal with the general public, but maybe not considered in one of these real high-risk industries?
Well, it's would definitely apply in that they would not be considered at risk, because when you're just serving the general public, I do not believe that you're serving someone who is more likely to have COVID-19, such as a first responder or someone in the healthcare industry, that you're actually knowingly treating positive COVID-19 patients. Also, in the restaurant industry, you're not really dealing with a bubble. The public is welcome. So in a nursing home situation, they're on lockdown, and they are very strict in who can enter their facility. You're not going to have the same thing with a restaurant or someone who deals with the public. They're taking on all comers. So if it's going to be difficult for a nursing home situation, then in a restaurant situation, it's very similar, because the public is the traffic that's going through their work environment, they're not going to be able to pinpoint how they got their COVID-19 in an employment situation.
Got it. Okay, so let's move on. So what are ordinary diseases of life and how are they different from COVID-19?
Well, ordinary diseases of life are the normal flu, the common cold, stuff that everyone gets, and not because it's significant to work. A disease that is significant to work would be mesothelioma. That's something that you get because you're more exposed to asbestos than the general public. The best example, it's not very common anymore, but I guess it was common a while ago, is black lung. That when I think of black lung, I think of the people who are in the coal miners, who they bring that parrot on their shoulder, and when they know when the parrot passes away, it's time to get out of the coal mine. And because that means the air quality is so unsafe that it killed the parrot that we need to get out of there. And all those workers would develop black lung, and that is something that was very unique to that occupation. The contrast to that are ordinary diseases of life. And that would be the common cold, flu, and lots of other conditions as well. And the thing is, it's COVID-19, it's so early in regards to how it's classified from a workers' compensation legal standpoint. I can't say at this point that it's definitely any different than an ordinary disease of life, because the issue really has not been litigated. We talked about companies who have accepted COVID-19 as a work-related condition, but I haven't seen anything go to a judge of compensation claims, which is the individual who determines workers' compensation disputes, where the employer and carrier has denied compensability of COVID-19, asserting that this is just an ordinary disease of life and it's not necessarily an occupational disease. So I think there's an argument to be said that COVID-19 is an ordinary disease of life. And so it's kind of like, it may not be any different. It really determines what a judge of compensation claim says. And if that judge of compensation claims gets appealed, what the First District Court of Appeals and the Florida Supreme Court says. So the answer to that question is, I'm not sure if they're any different. Dr. Nelson, do you have anything more to say about that?
No, unfortunately, now that COVID-19 is an ordinary disease of life, and now we kind of have to, because we had a patient come in here today, and she came in here for a musculoskeletal type injury for a follow-up, and she was having sore throat and she was having cough, no fever, and we told her, you know, she needed to leave and she needed to be tested. So now, pretty much everybody, and she wasn't so happy. And now everyone, you have to assume that you're positive until proven otherwise, just because of the nature of it, how contagious it is, bringing it home to someone who's elderly, who has other chronic diseases. And she was saying, oh, you know, can anyone have the common cold anymore? Yes, they can, but since this is so similar, common cold, COVID-19, and the flu, that needs to be ruled out. That needs to be ruled out first before we.
I think it might be a later question, but I was going to ask if there's anything specific to distinguish between the flu and COVID-19, because now that we're getting into flu season, is there anything specific, or is it really that we just have to assume you may have COVID-19 if you have any of those symptoms?
Well, two of the loss of taste and smell, which can be with the flu or with the cold because it affects the nasal passages, those are pretty much restricted to COVID-19. The shortness of breath, the decreased oxygen, cough, those are basically, we would have to assume it's COVID-19. But if there's any if there's any discrepancy, or if we're not sure, then they need to be tested. But that's going to be the problem now, because we are entering flu season. I have to put in the plug. Everyone should get their flu shot this year without fail. That means you too. See you there, Zach and Maxine. But yeah, so it's going to be really overrun the healthcare system. So we don't need to add flu to the mix also.
So at what point should an employee report to the employer a possible exposure to the virus?
Right away. Yes.
So as soon as they're experiencing symptoms, make sure the employer knows.
Yeah, if they if they have any inkling that they were exposed to someone, as soon as they find out that they were exposed to somebody, or if they're experiencing symptoms, they need to let their employer know right away, and then they'll steer them in the right direction of what to do. But there's no delay possible in that, because people are doing that. They're going to work and maybe they were exposed, but they need to let people know for themselves and for others, obviously.
And I'll elaborate
So
on.
is there such a thing as, oh, I'm sorry.
No, not a problem. If an employee does report to the employer that they have tested positive, I know that the employer has an obligation to let the other workforce know that there has been a confirmed positive amongst the workforce, so they can act accordingly. One thing is a little gray area. If someone says, no, I have not tested positive, but I have been exposed to someone that does, then it gets to a gray area as to whether the employer needs to let the workforce know that. And so I'm not sure if that, that's outside the workers' compensation arena, but that's a little interesting point as well when you're dealing with reporting. So once the employee reports, then the ball is in the employer's court. And what does the employer do with that? I know there's an obligation on the employer if there's a positive diagnosis, but just an exposure, I think, is a gray area that's up to each employer.
But if they were exposed, I legally wise, I don't know if they could force them to be tested or exclude them from work until they are tested. Because if you're exposed, I mean, you need to do the right thing and be quarantined until you have that negative test, and then let the others know as well. Let the other employees know as well.
Well, the answer to that question would go more into an employment law situation. I know that they cannot force the individual to get tested, but I'm pretty confident to say they can say that we're not going to allow you back on the job site until you come back with a negative test.
Okay, so it's pretty much the same thing. Getting around it, yeah.
So is there such a thing as a high-risk occupation? So I think we've already addressed this question. So let's just move on to the next one, since we did talk about those occupations. So if an employee in a high-risk job contracts COVID-19, is it automatically presumed that the employee contracted the virus at work?
Legally speaking, the answer is no. Okay, so this statute still makes them prove up that through clear and convincing evidence that they were contracted it through work. However, as we talked about this, Dr. Nelson talked about this, there are certain employers and municipalities that have agreed to have this presumption applied to them in regards to first responders. I know the state of Florida treats it that way. The state of Florida issued an informational memorandum on April 6, 2020, where they talk about their first responders and healthcare workers that contract COVID-19. They treat it like an occupational disease, which pretty much means they are treating it like it's presumed to occur at work. If the state of Florida has evidence to prove that it's more likely than not that they got contracted this outside of work, then they can deny the claim then. But that's reversing the burden of proof. That's putting the employer having the burden of proof to prove that it didn't happen at work. And as difficult it is for the employee to prove that it did happen at work, it's going to be equally difficult for an employer to prove the negative that it didn't prove at work. So in these situations where the employer brings on the presumption, it's pretty much, if they're tested positive, it's going to be treated like it's work-related. But if there's no presumption that's self-imposed, even in these high-risk situations, I think it's going to be very difficult for them to prove it's work-related.
So can an employer successfully defend against payment of wage loss benefits where an injured worker is laid off due to COVID-19?
The answer to that question is yes. And let me just explain what the question means. In this hypothetical situation, the injured worker has a compensable workers' compensation claim unrelated to COVID-19. They have a normal physical injury, and the employer has accommodated their restrictions, and they're earning at least 80% of their average weekly wage. So prior to the layoff, they're not receiving any wage loss benefits, because that's the cutoff for temporary partial disability. If they are earning 80% or more of their AWW, they're not entitled to wage loss benefits. Then, as many employers are experiencing now, business is going down, and there's productivity is down because there's less demand for product because everyone is staying home. And that's in the restaurants, airports, all across the board. And if there is an economic layoff, not just of the injured worker, but of the entire workforce, and that person is no longer employed and no longer receiving wages, a defense to paying temporary partial disability is that the loss of income is not causally related to the work-related injury, but it's due to economic reasons, i.e. the COVID-19 layoff. And that is something that you can definitely do. That's what I do on all my cases. And while I haven't seen a case litigated to a trial or a final hearing yet, where there's been a decision for judge of compensation claims, in one of my cases, an injured worker tried to get a $2,000 advance. And the reason why they were trying to get a $2,000 advance is because they were no longer working in the restaurant that they were working for after the accident that was accommodating the restrictions. And so they were unemployed now. So, but my argument was the reason for the loss of wages and their unemployment is not due to their on-the-job injury. It's due to being laid off due to COVID-19. So there's no causation between their loss of income and their industrial injury, so they're not entitled to $2,000 advance. In my situation, the judge agreed with me and said that because of the loss, no causal effect between the loss of income and their on-the-job injuries, they weren't entitled to a $2,000 advance. That's the closest thing that I have for a decision for a judge of compensation claims on this issue. But I think employers and carriers across the board are treating situations where there's a loss of income, not due to their on-the-job injury, but due to COVID-19, that they're not paying temporary partial disability in that situation.
So, this is a long question. What is the employer's obligation for wage loss benefits where an employee's work restrictions are being accommodated and the employee is earning his or her pre-accident wages, but the business must furlough or lay off the employee due to COVID-19?
Well, it's a long question, but I just stated the answer in the prior question, because that's the exact example I just gave. And so in the situation I gave is that they're being accommodated and they're earning at least 80% of their AWW and they get laid off. Now, the tricky answer is in the situation is that they're being accommodated, but they're still earning less than 80% of the AWW. So in a situation like that, they're entitled to temporary partial disability, just at a reduced rate. Now, in that situation, a lot of times what happens is that their income fluctuates. So the amount of temporary partial disability will fluctuate from week to week. Then they're laid off. Are they entitled to temporary partial disability then? That's a question that I have a hard time answering. I think the answer would be probably yes. But the impossible question would be how much? You know, it'd be very difficult to say because before, you know, the layoff, they were working some. Now, obviously after the layoff, they're working none. So I think in that hypothetical, they probably would still be entitled to some amount of temporary partial disability. As for the exact amount, I would say give the benefit of the doubt to the injured worker and you should be okay.
So, what is the employer's obligation for wage loss benefits where an employee's work restrictions are being accommodated, but the employee is not earning his or her pre-accident wages and is later laid off due to COVID-19?
It seems like I'm one question ahead because that's exactly the question that I just answered. So I would just repeat myself for there because that's what I just said is that they're being accommodated, but they're not earning 80% of the AWW and they are laid off. That kind of gets into a gray zone. I think that the employer would be responsible for paying temporary partial disability. The amount or the rate, it's going to be difficult to determine. And so if you want to avoid any type of dispute, you just give the benefit of the injured worker.
Okay. So where an employee is working from home due to COVID-19 and the employee is injured while working, can that employee bring a successful workers' comp claim to cover their injury sustained at home?
Well, that is a great question. And if you attended any recent workers' compensation seminars in the past 2 years. There's a Supreme Court case, a first DCA case that came out that says the Valcourt case, and it dealt with an insurance adjuster who was working from home. And as they were working from home during the workday, she was working on the second floor of her house, and she went downstairs to get a cup of coffee. And when she went to get a cup of coffee, she tripped over her dog, and she sustained injuries. And so the dilemma in that case is that she was doing something that was kind of incidental to her job, because the first DCA has previously indicated that coffee breaks and breaks of a short duration, injuries that occur in those situations are work-related and compensable. However, it's never been addressed a situation where it happens at home, and that something so unique to their home caused the injury, like tripping over one's dog. And in that specific example, the first DCA said, no, that would not be work-related. However, I can have examples where something would be work-related that likely would be compensable. So if a worker is working from home due to COVID-19, because either they have COVID-19 or because the office closed down and they're having people work remotely, and they do something that is so unique to their employment, like they trip over their computer. They need a computer to work, okay? It's something that's incident to them working, and they have their computer and there's a wire and they trip over their wire. I think that would be a compensable injury. So it's very fact specific, but the answer is, I believe, yes, they can bring successful workers' compensation claims to cover injuries at home. It's just going to be determined on what is the facts of the accident. If it's their dog, we've already been established that's not going to be okay. But if it's their computer or something that's more intrinsic to their work, I think the answer is yes, they would be entitled to workers' compensation benefits in that situation.
So how likely is it that a carrier will decide to accept a COVID-19 claim as compensable from the onset of the case?
Very unlikely, unless it's in a situation we've already talked about where the employer has a policy that any positive COVID-19 diagnosis is presumed to be work-related. If there's no internal presumption, I would say that from the onset, you're looking at a 1% chance that the carrier is going to accept compensability of the case.
So Dr. Nelson, how often is telehealth being utilized during this time? So for workers' comp care, COVID-19 exposure, what are you seeing?
A lot. And yeah, I've been getting very adept at using, thank you, Zachary, of course, for getting me with the telehealth. For COVID-19, it's indispensable because we've been doing that. We've been doing for months now, since March, and mainly with municipalities. We started with one of them. They were testing everybody and everything was being done with telehealth. Now we're having another municipality who, for police, fire, and corrections who were tested positive. Those are all done with telehealth. Fitness for duty for COVID-19. Also, obviously patients, now it's getting a little bit less, but patients didn't want to come in for either their initial visit for, not COVID-19, for the regular workers' comp injury, slip and fall, back, shoulder, etc. They don't want to come in for either for the initial visit or for the follow-up, and we've been using that less lately. We had one today who wasn't able to come in or didn't want to come in, so we've been using that extremely, yes, very, very frequently, and it's a godsend. It's amazing. The patients appreciate it, and if you're homesick with COVID or whatever, it's their lifeline. It's great.
Yeah, so it has been a great tool. And just another
Amazing.
Quick plug is that we do have the telehealth for extended hours. So even if there's an injury after our business hours, you can get on the video chat with the doctor and generate a DWC-25 at 8 p.m., 9 p.m. at night while we have these extended hours. So you could always reach out to one of us to learn more about that program. So can a COVID-19 test be given for pre-employment purposes? Dr. Nelson?
Yes, well, legally,
Or-
legally, I don't know, but I would assume yes, because that's what we've been seeing. First, we were seeing it for surgical clearances. Pretty much every surgical clearance that comes in, they're requiring a COVID-19 test. And for pre-employment, either they're asking for the antigen or the antibody. So I would assume that legally it is okay because they are requesting it. Mr. Borah? Yes?
Yeah,
Well, from a workers' compensation standpoint, that's outside my sphere because this is not, this doesn't really deal with an on-the-job injury. It's more
Okay.
of an employment sense. However, I think I agree with you in that I think this is something that they are legally allowed to do because they have to protect their workforce. And so I don't think there's any problem with it. However, ultimately, I would defer to an employment lawyer if an employment lawyer said otherwise. However, I doubt that would be the case.
Yeah,
Yeah, now,
because
I did hear from an unemployment lawyer in the press. I mean, I'm not one, but just to reiterate, what they had told me is that if you were to do a COVID-19 test for a pre-employment purpose, if you were to deny the employment based on that, you have to prove that you needed to bring that employee in immediately, and that's why you denied employment. Otherwise, you still have to keep that offer on the table, just maybe not hire them at that moment, but you can't use it as a reason to deny an employee unless you could show that immediacy they need to start work. I'm not sure if that's changed, but that is what I was advised in the past.
makes sense.
Okay, so how has COVID-19 affected treatment for injured workers with existing claims? So have you noticed any delays, cancellations, staff reductions, less surgery?
All of the above. We've talked about a lot of things that have been affected already, just regards to layoffs. So when someone gets laid off and they also have an on-the-job injury, they're going to blame their on-the-job injury, or they're going to use their on-the-job injury as to an attempt to try to get paid for their loss of earnings. And they can get unemployment, but unemployment only lasts a certain amount, and so they're going to want workers' compensation to kind of come into play. But however, being laid off has really nothing to do with workers' compensation. They're laid off due to the worldwide pandemic. It has nothing to do with their on-the-job injury. Then, in regards to medical issues, telemedicine is abundant now. Now, there was a time from March to about June where that's the only type of medicine I really saw practicing. There were exceptions to the rule, but the majority was the only type of medicine that was being practiced was via telemedicine. And there's limitations that telemedicine can have. Obviously, you can't do surgery via telemedicine. That's obvious. So I know the hospitals for elective surgeries were off the board. And so we had cases where injured workers were scheduled for surgery and all those surgeries were postponed. And so that means that the insurance company or the self-insured employer has to continue to pay this injured worker during the time period that the surgery is being postponed. There's many cases I have that where the doctor just didn't have the ability to perform the surgery because the hospital wasn't allowing it. Now, when I've also had situations where an injured worker has a surgery recommendation and the doctor will perform the surgery, but then the injured worker gets diagnosed with COVID-19. Obviously, when that occurs, they have to quarantine themselves and the surgery is going to be put on hold. In that situation, are we going to be paying temporary partial disability where the delay of the surgery is not due to anything that's really work-related for the injury, but it's due to COVID-19 diagnosis? I think you'd have a good argument that you could deny temporary partial disability benefits during that time period where the surgery is being delayed because of the COVID-19 diagnosis of the injured worker. So another thing is when you deal with litigation, sometimes you need an independent medical examination. And that's where you retain a doctor to just evaluate the injured worker to give you their expert opinion as to what is at issue. Now with COVID-19, an IME is very similar to an elective surgery. It's something that's non-essential. So I had cases that were scheduled for final hearing for trial where we needed IMEs. However, I could hardly find a doctor who was willing to do an IME in the climate of COVID-19 because they don't want to be unnecessarily exposed. And also the injured worker doesn't want to be unnecessarily exposed either. The claimant doesn't want to be unnecessarily exposed. So there were lots of hurdles. Fortunately, things are calming down now, and it's slowly going back to normal. I think elective surgeries are being performed and the delays are to a minimum. And I think that doctors are now getting back to business, but these are just a multitude of ways of how COVID-19 has affected the nuts and bolts of workers' compensation claims being adjudicated.
So those were all the prepared questions. Now, there were several great questions that we've had in the chat box, but we are at 3 o'clock and we do need to do the prize wheel since people may have to get on to other things. But if we didn't address your question, we will be putting out a correspondence with the recording to this lecture, as well as those additional questions. So definitely be on the lookout for that. I also just want to make one disclaimer that this information is ever changing and evolving. So today is September 23rd, 2020. And just to note that this information is relevant as of today. Tomorrow, the CDC could put out a new guidance. So we have to just note that this information may change, but it is valid as of today.
And I think also one other thing to note is that we try to keep our website, www.physicianshealthcenter.com, current with updated blogs. So keep an eye and we'll send them out to you, but keep an eye and always call us because we like talking to our clients. So give us a call if you have questions. Dr. Nelson always says yes about getting on the phone and speaking to our accounts.
Yes, I do.
Let's see who's the big winners today.
Okay, so
we have 2 prizes.
We have 2 prizes. So what's the first prize we're giving away?
Nancy Curry had said it's going to be, I believe, a $50 lunch card. Was that it, Nancy?
DoorDash.
DoorDash from HR Law. So spin the wheel, Zach. Sometimes it takes a few minutes.
You have to be present. So say something in the chat box. And if you don't say something pretty soon, we're going to have to move on to the next person. Let's spin the wheel.
I don't see it spinning, Zach.
It's a little slow. Okay, Mercy. Mercy, are you here? Say something in the chat box. We have a little bit of a delay.
Here.
Did she say
I'm not
here?
sure where, yes, hi. Wait a minute.
Wait, I'm going to the chat to check.
Yes, I see it. From Nancy.
Okay, Mercy, she's here. Okay, you are the winner. Okay, we will be emailing that to you.
Okay, and then PHC is giving out a $50 Amazon card.
Ooh, can I be in the drawing for this one?
Oh, no, Zach.
Here we go. Stephanie.
Stephanie,
if you are here, say something in the chat box.
Stephanie who, Zach? I don't see.
Dupox?
Oh, here she is. She's saying I'm here.
Okay.
And somebody asked, how do I play? And really, you don't have to do anything. If you were registered for this webinar, immediately your name was put in the prize wheel, and there's nothing you have to do. You just have to be present to win. So we have 2 winners, and Mercy and Stephanie. I'm going to write, and we will be in touch with you because we want to know which email to send your gifts to. Mercy. And I believe that's it for today. We're going to be continuing to run these Q&As every month. So we ask you to continue to submit questions because we're going back and forth between a employment attorney and a workers' comp attorney so that we cover all bases. Anything else, Zach?
No, I think we've got everything covered. So just be on the lookout for our next email, which will have the link to the video and also the answers to any of the questions that were posed that we did not have a chance to get to.
Well, I just want to thank everyone for chiming in to listen to us, and also want to thank Max and Zachary for allowing me the opportunity to speak. It's always a pleasure working with you guys, and also teaming up with Dr. Nelson as well. Thank
Yes, it's been a pleasure. Thank you very much.
Thank you. And hopefully, you know, many of you attend our Emerging Trends luncheons, and of course, that's always the best, because there's nothing better than CEUs, lunch, and great speakers. But hopefully, when we get back to normal, we'll be able to resume those sessions. Thank you for attending.
Thank you, everyone.
Thank you,
Thank you.
everyone. Have a
Thank
great
you.
afternoon.
Thank you,
Bye-bye.
everyone.
Bye-bye.
Bye.